Dr. Lopez, can you also speak more broadly to innovative telehealth tools that are making an impact on symptom management and overall cancer care?
Sure. So one of the things that we know, is that, for example, people have appointments every 3 weeks, or they have appointments once a month with the oncologist, and a lot can happen in that time. So setting up systems that are assisted by technology so that patients can report their symptoms in real time can be very helpful. And, some of this may require, it may not be a common way where the person may be familiar going to a computer or going to their phone to kind of say, this is how I'm feeling. So that may require some engagement, education, but often, regardless of age, regardless of background, people find that really easy and find that so helpful to be able to say, oh, was it 2 weeks ago that I had that? As opposed to just saying, hey, I just had this. And then it can happen, anytime, day or night, that the patient can report. And that way it's just so helpful to have an intervention in real time. The other part that's good is that often some of these systems can kind of track. So, we can look at it together and say, you know what, your fatigue tends to be a couple of weeks after therapy. So how can we either prepare for that, or just to have the reassurance that, yes, you have that dip, but it gets better and you get through it. So being able to look retrospectively and identify that can be helpful. And I think also just the ease for people to be able to connect with multiple specialists, sometimes to have multidisciplinary visits where not only does the patient meet with everyone, but the patient can see that we're all meeting and interacting together. So all of those are incredible tools. One of my favorites is patients are in the hospital, and patients are in the hospital a long time, on some occasions. So, and even if a person's not there a long time, it can feel like a long time. So to use the technology, not just to connect the patient, the healthcare team, but to use the technology to connect the patient with his or her family. And I think especially, a lot of people have, smartphones, but, it's using your minutes. Sometimes the internet may not be so strong. So to use the technology that would be used for the clinical piece, to have that available in the inpatient setting so that patients can feel connected.
That's a really great thought that you brought up too. I know when the pandemic was in full swing, but patients were starting to go back into the office to see their provider. For me, I was not allowed to take my husband in with me, so I went in alone. I was far enough along in my journey. I didn't necessarily need a care partner with me, but some patients do, maybe a newly diagnosed patient. So that is a really great point. Say a patient has to come in by himself or herself. Is that a technology they can use? Are you willing to let them use their phone to maybe FaceTime during that call? Or we had to use the actual physical landline because my phone did not connect. The signal wasn't strong enough. But do you allow that during your appointments to have patients contact somebody? Okay, that's great. Yeah.
And also, there's pandemic, but there's also people live everywhere. So you could say, their son could be in California and I'm in Philadelphia, and this way it's okay. We'll just beam them in.